How to keep your child healthy.
After 2 years of age, your child will begin to visit their doctor each year for a basic checkup. Find a pediatrician who you trust and make sure to stick to this schedule. Your child's doctor will take a variety of preventative measures each visit, including tracking your child's growth and development. Use well-child visits as an opportunity to ask any questions that you have regarding your child's physical, mental, or emotional development. It may help to write down questions before you arrive. For example, you might ask, "Should my toddler be using a spoon and fork yet?" Your child will also generally receive vaccinations at well-check visits. These vaccinations offer protect against an assortment of more serious illnesses such as polio. A yearly flu shot can also help prevent a lot of misery from the flu. Don't forget the importance of taking your child to the dentist as well. At least once every year, your child's teeth need to be cleaned and checked out. Place all toxic chemicals and cleaners in an inaccessible area. Hide all cords and wires. Secure furniture that could topple over. Remove any sharp or dangerous objects. Even after your child is beyond the baby stage, keep an eye out for potentially dangerous items in your home. You may want to ask that your relatives or family friends safety-proof their homes as well, especially when your child visits. Medications, for example, need to be stored in a location that is inaccessible for a child. Keep hands clean. Regular hand washing dramatically reduces the passing of respiratory and gastrointestinal illness, so get your kids in the habit of scrubbing up, or using a hand sanitizer, when they leave preschool or daycare, after every play date, and before they eat. Teach kids to sing happy birthday to themselves twice before rinsing. Scrubbing for 15-20 seconds is key. Be active every day. Studies indicate that regular, moderate exercise can reduce the number of cold and flu episodes that occur over the course of a year by 25-50%, possibly by boosting the circulation of infection-fighting cells. Get plenty of ZZZs. Make sure kids stick to an early bedtime. Sleep deprivation nearly doubles the risk of getting a cold or flu, Dr. Rothbart says. Most babies need approximately 14 hours of sleep a day. Preschoolers need 11-13 hours of Z's. Avoid touching your face. Cold and flu viruses enter the body through the nose, eyes, and mouth, so help your child keep her hands away from those areas. Yes, it can be very difficult to accomplish. Hand washing at strategic moments is all the more important. Teach your child never to share a straw, cup, or toothbrush. Consume a balanced and healthy diet. Meals with plenty of colorful fruits and vegetables will help boost your child's immune system. Look for foods rich in vitamin C, broccoli, strawberries, and oranges, and vitamin D, tuna, fortified milk, and cereals. Eating yogurt with active cultures, probiotics, can also help build defenses. Get the flu vaccine. The Centers for Disease Control and Prevention, CDC, says it's the single best way to prevent the flu. What are you waiting for? Facebook, Pinterest, Twitter comments. Your 15-month-old is just getting over a cold when he spikes a fever and you notice that his ears are red or that he is tugging at it. The cause? Most likely an ear infection, which, after a cold, is the most common reason for a visit to the pediatrician in children under 3. The culprits are your child's tiny eustachian tubes, which connect his middle ears with the back of his throat and normally drain fluid. When these passages become clogged, fluid builds up and presses against the eardrum, and your child starts yelling in pain. The tubes can also be blocked when babies drink from their bottle while lying down and a small amount of milk flows back into their ears. If they have an ear infection, they'll usually cry more during feedings because sucking causes painful pressure changes in their ears, says Dr. Johnston. They may also fuss more when they lie down and have trouble sleeping. Older children may tug at the affected ear, but that's a less than reliable symptom in children under 2 because their nerves aren't developed enough for them to pinpoint the origin of the pain, says Dr. Johnston. Occasional vomiting and diarrhea in an otherwise healthy child is usually no cause for alarm. But if it's accompanied by a bellyache and fever, she may have gastroenteritis, which is a fancy name for an uncomfortable inflammation of the stomach and intestines. It's most often caused by an infection, but it can also flare up if a child is on antibiotics, says Dr. Shook. Although you should let the pediatrician know if your child has symptoms of gastritis. If you liked the video, subscribe to our channel for more awesome videos. Check the description below and thank you so much for watching.